Hello friends. Let's begin with the MCQs. And the first one is it's Santanu and avid reader. And the first year resident recently finished Joseph Heller's famous novel Catch 22. So while discussing the book with his friend, he realized that the title was an acronym of the chromosomal disorder they have studied. Which of the following is the least likely feature of this disorder? I will repeat the question is basically they are asking it's a Catch 22. So Catch 22, what it refers to, which chromosomal disorder they are asking. And the options are thymic aplasia, hypocalcemia, left palate, or it's a thinner anomalies. I will repeat it once again. It's a Catch 22 and options which they have given is thymic aplasia, hypocalcemia, left palate, and it's a thinner anomalies. It's a request. Okay. If anyone wants to answer this. Okay. Basically, Catch 22, it's a acronym for some chromosomal disorder. I have to tell that. The answer is D. It's the anal anomalies. C is C is basically for cardiac anomalies and not for renal anomalies. It's CATS 22 syndrome is there, and if it's a CATS, that is Catch 22 syndrome. So the option here is right one is the anal anomalies. CATH is basically it's a C for cardiac. A for what is abnormal faces, TH for what they are given is thymic aplasia, and what was there? C for left palate, and H for hypocalcemia. I have to remember that it's CATH 22 syndrome. Next we have it's an anatomic question. Next we have a 56-year-old woman presents with abnormal movements of the limbs. So a lesion of the globus pallidus is suspected. Which of the following did she most likely present with? And the options are chorea, athetosis, hemibalismus, or it's a Parkinsonism. Basically, you have to tell where is the site of the lesion for this. It's for globus pallidus. The site is there given. The site is globus pallidus. So you have to tell which is the most likely present with. It's chorea, athetosis, hemibalismus, or Parkinsonism. Anyone if you like to answer this? The answer is athetosis. Because athetosis is basically related to globus pallidus. That is, it will cause spontaneous, continuous regarding movements of the hand, arm, neck, or face. Its athetosis is for globus pallidus. Next, the question we have is protein denaturation in muscles of a burn victim leads to an attitude of general flexion of the body. The posture is called. Basically, I will repeat once again. It's a protein denaturation in the muscles of a burn victim leads to an attitude of a general flexion you see in the body. So the posture is called what? Its options are brawler attitude, Deluist attitude, pugilistic attitude, or it's gladiatorial attitude. If you can tell, if you know the answer, the posture in a burn patient that is overall flexion is there, what it is called? Options I repeat, it's a brawlers, dualist, pugilistic, or it's a gladiatorial attitude. Okay, the answer here is it's a silly mistake. Okay, the answer here is C, that is the pugilistic attitude. In burns patient we see a pugilistic attitude. The attitude of a general flexion which we see in a burn patient is called the pugilistic attitude. Next question we have, it's an ultrasound finding in a twin pregnancy is given below. And it's like AFI is of a twin A is 26 cm, of a twin B is 4 cm, and urine visible in the bladder of twin A, urine not visible in the bladder of twin B. It's an abnormal Doppler flow in twin B. What is the Quintero staging in this condition? If you know the Quintero staging, then only you can answer this. Anyone can tell what is the Quintero staging? Because it's for twins. They have given is from 1 to 5. Quintero staging is from 1 to 5. But the answer is stage 3. It's a long one, that's why I cannot tell here. But it's a USG indicator of twin-twin transfusion syndrome, with the twin A being the recipient and twin B being the donor. Oligohydromas, absent urine, and abnormal Doppler flow findings in the donor twin indicates it's a stage 3 of twin-twin. Usually it's from 1 to 5 and there is a staging for Quintero staging. You have to remember that. It's a long one. Okay, next one, it's a total ATP generated per ton of the TCA cycle is. I think this you can tell. Anyone can tell this? I will repeat. It's a total ATP generated per ton of the TCA cycle is. It's a 10, 20, 30, or 40. At least guess. I think anyone can guess at least. Okay, the answer here is A. That is 10 is the right answer. 10 Yeah, 10 is the right answer. 10 is the total ATP generated per turn of a TCA cycle. So yeah, it's like 10 ATP per turn of TCA cycle. So this is also factual question. Yeah, next we have OBG question. It's a G3P1A1. Oh yeah, pre-eclamptic patient who had 33 weeks of gestation came to you for a regular antenatal checkup. At present, her BP is 130/90 and NST is reactive. What is the plan of management for this patient? So actually you have to tell the diagnosis, otherwise you won't be able to tell. I'll repeat, it's a G3P1A1 patient with it's a pre-eclamptic patient. 33 weeks of gestation for a regular antenatal checkup. And at present, her BP is 130/90 and NST is reactive. What is the plan of management for this patient? I will tell. And the options are A, that is the wait till 37 weeks of delivery for delivery. Deliver at term, induce at 34 weeks, so it's perform LSCS at 34 weeks. So yeah, if you can guess at least. What is the diagnosis, if you know? Basically, it's already have given it's a pre-eclampsia. And BP also they have given 130/90. Because it's a mild case of pre-eclampsia, and so what should we do? Anyone? Because in severe we deliver like that only in LSCS. But yeah, if it's a mild stage, the answer is A, that is the wait till 37 weeks of delivery. And yeah, they have also given that only. If it's a mild, it will be greater than 37 weeks only you have to do. If it's severe and greater than 34 weeks you can do. And yeah, if it's a eclampsia or HELLP syndrome, immediate termination irrespective of the gestational age. And if it's a gestational hypertension, it's 38 to 39 weeks. So yeah, you have to remember this. But yeah, if it's a mild, you can wait for 37 weeks. Next, we have a 55-year-old man. 55-year-old man presented to the OPD with complaints of intermittent constipation and sense of heaviness in his lower abdomen. And his barium enema film is given below. Which of the following statement is false about the pathology responsible for his condition? So yeah, I will repeat. It's a 55-year-old man who is present to you with intermittent constipation is there, and there is a sense of heaviness in his lower abdomen. His barium enema they have given below. Just I will tell what is there in the barium enema, and the question is which of the following statement is false about the pathology here. So yeah, it's a barium enema. It's showing basically there is a false diverticula. Yeah, it's a false diverticula which is being seen in the barium enema. So now if you can tell, okay, the question is which of the following statement is false about the pathology given below. I just tell the pathology is a diverticular. You can tell it's a colonic diverticulosis. So yeah, the options are it's first is commonly occurs along the mesenteric side of the colon. Second one is it's a sigmoid colon is the most common site, and third one is it is characterized by through diverticula, and the fourth is causes formation of pulsation diverticula. So you have to tell which of the following is false regarding the pathology of colon diverticulosis. So yeah, if you can tell this, anyone? It's a case of colon diverticulosis. That is, it's a false diverticula. So yeah, okay, I will tell its answer is C. Yes, that it is characterized by through diverticula. No, it's a false diverticula in colon diverticulosis. It's a false diverticula. Another options basically what they have given is right. That is, first was commonly occurs along the mesenteric side of colon. That is right. Second was sigmoid colon is the most common site. And whereas D was its formation of pulsation diverticula. But yeah, you have to remember basically it's a false diverticula. So colon diverticulosis is a false diverticula. That much. And next we have it's a 68-year-old man with fever is there, and he has WBC of 1,50,000. His peripheral smear they have given below, and yeah. So which of the following is true about this condition? So I'll just tell what is there in the peripheral smear, then you can understand. Basically it's smudge cells are present, yeah. Lymphocytes are there, which has anti-cytoplasm, and smudge cells are present. So just remember what is there in the smudge cells. On the diagnosis for smudge cells is whatever diagnosis, if you can tell. I will tell the options here. Which of the following is true regarding the smudge cells in the peripheral smear? So yeah, the options are it arises from myeloid lineage. Option B is radiation exposure is a risk factor. Option C is it arises from the T lymphocytes, whereas option D is patient may be autoimmune hemolytic anemia. So yeah, if you can tell the answer, it's a smudge cell. Which of the following is true? Anyone? I am only telling the answer today. Okay, yeah, the answer is basically what is a diagnosis? Diagnosis is basically if you have smudge cells That too lymphocytes are there, small round lymphocytes are there, which can anti-cytoplasm and smudge cells, which goes towards the CLL. Yeah, CLL it goes toward, and yeah. And the option which is right here is D, that is the patient may have an autoimmune hemolytic anemia. It's autoimmune hemolytic anemia is seen in CLL patients. Another is like T lymphocytes. No, it's not T lymphocytes. Then next was radiation exposure to risk factor. No, that is also wrong. And the first one, it arises from myeloid lineage. No, basically it's not myeloid lineage, it's a lymphocyte. No, it's not myeloid lineage. So yeah, it's a case of CLL, and it's not linked to exposure, what I told already. Yeah. So yeah, next question we have, gray baby syndrome is there. It is associated with the use of which of the following drugs? Just letting you guess, at least if you don't know the answer. Gray baby syndrome, it is associated with which of the following drugs? And the options are clindamycin, chloramphenicol, tetracycline, or clotrimazole. So yeah, if you can tell, it's a gray baby syndrome which is associated with which of the following drugs? Clindamycin, chloramphenicol, tetracycline, or it's a clotrimazole. Anyone? Gray baby syndrome. Gray baby syndrome is associated with which of the following drugs? I know you can tell this. I will repeat, it's a gray baby syndrome and it is associated with which of the following drugs? And the options are clindamycin, chloramphenicol, tetracycline, and clotrimazole. So yeah, MD medicine can tell us. Yeah, the answer is B. I will just tell it's chloramphenicol is the right answer. Chloramphenicol basically it is associated with the gray baby syndrome. It's a developmental deficiency, and that is of the enzyme of glucuronil transferase. The enzyme metabolizes the chloramphenicol in neonates. Its deficiency will lead to inability to excrete unconjugated drugs adequately through renal excretion. So yeah, basically it's a chloramphenicol which is called gray baby syndrome. So you have to remember that. So yeah, it's a gray baby syndrome. I will just repeat, it's a gray baby syndrome. It is a developmental deficiency of the enzyme that is glucuronil transferase, and the initial symptoms will be vomiting, refusal to suck, irregularly rapid respiration, and periods of cyanosis. So yeah. Next question we have, which is the most common benign tumor of the bone? This at least you can tell this. Which is the most common benign tumor of the bone? Osteoma, osteoblastoma, osteochondroma, or it's a unicameral bone cyst? So yeah, I want this answer. Please. I want this answer. What is the most common benign tumor of the bone? Osteoma, osteoblastoma, osteochondroma, or it's a unicameral bone cyst? Anyone? And this also, okay, I will only tell. Yeah, the answer is C, that is the osteochondroma is the right answer. It is the most common benign tumor of the bone. And yeah, it's a developmental malformation through that all this. If it's osteoma is the most common through benign tumor of the bone, whereas osteochondromas are developmental malformation rather than through neoplasm. Basically, if they ask you what is a true benign tumor of the most common benign tumor, it's osteoma. So yeah, next we have, what is the most common type of well in India? Tube well, dug well, artesian well, or bore well? So yeah, this, okay, I will tell. It's which is the most common type of well in India? Tube well, dug well, artesian well, or bore well? So yeah, dug well is the most common type of wells in India. It's a source of groundwater. Okay, I mean, it's a dug well. Then, as a medical officer in an occupational health program, you encounter an employee with hearing loss. So you are suspicious that he is faking it to be claims compensation. Which of the following tests is least useful in this scenario? Sanger test, Lombard test, stapedial reflex, or it's a Rennie test? So yeah, I repeat, it's if you are a medical officer and you are a medical officer and an employee comes to you with hearing loss. So if an employee comes to you with a hearing loss, you are suspicious that he is basically malingering. So what is the following test is least useful in this scenario? So yeah, you are suspicious that he is faking and it's for claim compensation. So which of the following tests is least useful in this scenario? That is hearing loss. And the options are Sanger test, Lombard test, stapedial reflex, or it's a Rennie test. So yeah, options are Sanger, Lombard, stapedial reflex, or it's a Rennie test. So what will you do so that basically you can catch the malingering in this condition? Anyone? It's it's a D. That is the Rennie test. Rennie's test. What you do? Yeah, it's readiness test, what to do for malingering, and the least useful, sorry. Yeah, it's the least useful. Others are like Stenger's, Lombard and Stapedial tests are let's say used for the malingering, whereas the least, what I was telling, it is readiness test. So yeah. Next we have, it's a 58-year-old woman who comes to you with complaints of painless lump in her left breast, which she noticed during a routine self-examination. On palpation, a hard lump with irregular margins and enlarged left atrial lymph nodes were found. Which among the following is the best modality to detect the malignancy in this case? 2D mammography, digital mammography, tomosynthesis with conventional mammography. It's a fluid digital mammography. So yeah, answer is, I think, digital. No. Okay, the answer is C. That is. Okay, the answer is C. That is, it's a tomosynthesis with conventional mammography, which we use for basically malignancy in the breast. So yeah, I will repeat this. It was a 58-year-old woman, painless lump in the left breast, and she noticed that during her self-examination and palpation there was a hard lump with irregular margins and enlarged left axillary lymph nodes. So what was the best test for this? And the answer was C. That is, it's a tomosynthesis with conventional mammography. So yeah, because hence accuracy is more in that case. That's why we use tomosynthesis with conventional mammography. So yeah, next question. It's a tourist who came to the OPD with complaints of abdominal pain and watery diarrhea. Which of the following strains of E. coli is most commonly implicated in this condition? This I think you can tell. Yeah, the options are enteropathogenic E. coli, enterohemorrhagic E. coli, enterotoxigenic E. coli, or it's enteroinvasive E. coli. Basically, a tourist comes to the OPD with abdominal pain and watery diarrhea. Which of the following strains of E. coli will be present? Enteropathogenic, enterohemorrhagic, enterotoxigenic, or it's enteroinvasive? Yeah, I think you know the answer, but you won't tell. Okay, it's a C. C is the right answer. Enterotoxigenic is the E. coli is the right answer. It's a traveler's diarrhea. So in case of traveler diarrhea, it is enterotoxic E. coli. So next question we have is which of the following is the most common psychiatric comorbidity that you expect to find in a patient with anorexia nervosa? And the options are social phobia, depression, obsessive compulsive disorder, or it's a delusional disorder. So yeah, I repeat, it's which of the most common psychiatric comorbidity you will be expecting with a patient with anorexia nervosa, and the options are social phobia, depression, obsessive compulsive disorder, or it's a delusional disorder. Anyone can tell this? Which is the most common comorbidity with anorexia nervosa? And yeah, the answer is depression. So basically, we see depression is most commonly associated with anorexia nervosa. So yeah, 65% cases we have that, and social phobia is also there. But yeah, most common is depression we see with the patient of anorexia nervosa. Next we have which is the most common site for lymphoma in patients with AIDS? CNS, abdomen, spleen, or thymus? At this site you can tell. Which is the most common site for lymphoma in patients with AIDS? CNS, abdomen, spleen, and thymus. Anyone? Am I audible or it's just I'm speaking? Yeah, it's there. Yeah, which is the most common site for lymphoma in patients with AIDS? Okay, yeah, the answer is yeah. Okay, the answer is A. That is, CNS is the most common site for it's a lymphoma, and in AIDS, especially in AIDS, and yeah, that much. Yeah, it's not much. You have to remember this. It's a CNS, which is the most common site for lymphoma in AIDS patient. Next, we have what is the maximum percentage of oxygen that can be delivered via nasal cannula? It's 100%, 90, 40, or 10. So yeah, I can tell this. What is the maximum percentage of oxygen that can be delivered via nasal cannula? So you might be knowing in COVID cases we use a nasal cannula. So what is the maximum percentage of oxygen that can be delivered via nasal cannula? And the options are 100, 90, 40, or 10 percentage they have given. So yeah, if you can tell. Okay, I will only tell. Yeah, its answer is C. That is 40% only oxygen can be given to a nasal cannula. Yeah, it's a low flow variable, and only 40 to 50% you can give. that too at flow rate greater than 10 liter per minute. So yeah, next question we have. Next we have the clearance of a drug which follows first order kinetics is 0.2 liter per minute and the volume of distribution is 40 liters. So what is the T half of that drug? Actually it's a first order kinetics. Yeah, for first order kinetics you have one formula. So here the options are 140, 220, 240 or 180. So yeah, if you know the formula for first order kinetics, you can tell. I'll just tell the values. Its clearance is 0.2 liter per minute, volume of distribution is 40 liter, and what is T half? So yeah, if you can tell the T half now with the formula. Anyone? See, VD is basically volume of distribution, that is 40 liter they have given, and the CL is clearance, that is 0.2. So the formula for first order you might be knowing, it's a 0.693. You know, yeah, it's 0.693 into VD by CL. So it's a 0.693. VD they have given is how much? What I told, 40, and CL is divided by 0.2. So yeah, the overall the answer coming is 140 minutes. So T half for first order kinetics will be 140 minutes in this scenario. So yeah, next we have a person is there who wants to study about the relationship between smoking and lung cancer. So he collects data about the people disease with lung cancer from the government hospital and the number of cigarette packets sold at the same time. So which type of study it is? Because it's a PSM question and the options are cross-sectional, ecological, experimental, or it's a quasi-experimental. So repeat, it's a person who wants to study the relationship between the cigarette, it's basically between the smoking and lung cancer. So he collects the data from the hospitals, government hospital, and he collects about people diseased with lung cancer and the number of cigarettes used sold at the same time. So what is the type of study? If you can tell, it's a cross-sectional, ecological, experimental, or it's a quasi-experimental. Yeah, anyone? Okay, yeah, the answer is B. That is, it is basically it's a ecological study. Why I will tell you. See, first option was cross-sectional, but cross-sectional if you use it, we only use for an individual, not for the whole community or like that, not for the many people. So yeah, in option A that I was telling, it is for the only for individual, and option C that was experimental. There is no experiment done here. Yeah, it is there. And for D it is quasi-experimental. It's a non-randomized pre-post intervention studies. So basically it's a ecological study, as the unit of study is the population. So when you consider the population as the unit of the study, you have to tell it's a ecological study. Whereas in cross-sectional, it's a individually the unit of the study. So yeah, the number of cigarette packets sold at the same time is the data of the about the population. Yeah. Next we have the arterial blood gas analysis is given. So it's a ABG question. So pH is 7.3. HCO3 is 10, PCO2 is 30 mmHg, so which is suggestive of partially compensated metabolic acidosis. So what is the mechanism for the secondary disorder? So and the options are hyperventilation causing decreased CO2 washout, hyperventilation causing increased CO2 washout, and it's an increased tubular reabsorption of HCO3, or it's an increased excision of H+. Because I will repeat, it's a case of partially compensated metabolic acidosis. And pH is 7.3, HCO3 is 10, PaCO2 is 30. So they are asking, it's basically what is the mechanism of secondary disorder, that is a partially compensated metabolic acidosis. Options I will repeat for the last time. It's an hyperventilation causing decreased CO2, hyperventilation causing increased CO2 washout, or it's an increased tubular reabsorption, and or it's reabsorption of HCO3, or it's an increased excision of H+. So yeah, if you can tell this answer, it's a partially compensated metabolic acidosis. Okay, I will going to tell its answer is A. That is, it's a hyperventilation causing decreased CO2 washout. Basically, see, if it's a metabolic acidosis, it is a secondary metabolic acidosis. Yeah. So it will be with respiratory alcohol acidosis. Yeah, acidosis only. Yeah. It's a suggestive of metabolic acidosis with respiratory acidosis in this condition. And if there is respiratory acidosis, you have to remember it's basically because of hyperventilation. Something has been, CO2 has been washed out from this. So yeah, it's decreased CO2 washout in this condition causing hyperventilation. So yeah. It's a secondary disorder. Respiratory acidosis here is caused due to decreased CO2 washout due to hyperventilation. Yeah, this is a new for me also. So yeah. It's okay. It's a decreased CO2 washout due to hyperventilation. And yeah, you have to read this. I will also read this again. So next we have an elderly woman presents to you with the following findings. She gives a history of chickenpox in her childhood. Which of the following is false about the cranial nerve involved in this condition? Basically, it's if you have a chickenpox in your childhood, what will be in the adulthood? It's a varicella. Anyone can tell what is that? What will be the diagnosis if you have a chickenpox? You have a history of chickenpox in the adulthood and it comes to the old age. Basically, it's herpes zoster. So I will just tell which of the following is the false about the cranial nerve involved. Basically, you can tell what is the cranial nerve involved in herpes zoster, then only you can answer this. So yeah, anyone can tell what is the cranial nerve involved in herpes zoster? Anyone? Okay, the options are it is predominantly sensory. The motor innervation is exclusively carried by maxillary nerve. The cornea is primarily innervated by ophthalmic division, or it provides motor supply to middle pterygoid. Basically, before all this, you have to know what is the nerve supply for this in herpes zoster. Which nerve will be affected in herpes zoster? It's a case of herpes zoster ophthalmicus, and the cranial nerve involved is trigeminal nerve. So yeah, after this you can tell the answer. Okay, which of the following was in this false? So yeah, the false was B, that was the motor innervation is exclusively carried out by maxillary division. No. Basically, it's mandibular division, not maxillary division. Other options were right. See, trigeminal nerve is basically predominantly sensory, and the motor innervation is exclusively carried on by not maxillary, it's by mandibular division. You have to remember that. And cornea is innervated by the ophthalmic division, because for trigeminal there is three: ophthalmic, mandibular, and maxillary. Yeah, maxillary. So it's a three parts of trigeminal nerve. It's ophthalmic, maxillary, and mandibular nerve. So yeah, motor innervation is exclusively by mandibular nerve. And the last one is it provides motor supply to the middle pterygoid. And that is the right one. So next we have a 40-year-old man is there who develops thick yellowish discharge from his urethra 2 weeks back after unprotected sexual intercourse. So which of the following is the recommended diagnostic test? And the option is culture and sensitivity, nucleic acid amplification test, LISA, or it's a microscopic showing inclusion bodies. So I repeat, it's a 40-year-old man. He develops a thick yellowish discharge from the urethra 2 weeks after an unprotected sexual intercourse. What is the following? Basically, you have to tell the diagnosis. If you know diagnosis, then you can tell what is the investigation of choice for this condition. Anyone with it's unprotected sexual intercourse, and he has a thick yellowish discharge from his urethra 2 weeks after the sexual intercourse. So it's a case of, anyone can tell? Okay, it's a case of chlamydia. Yeah, it's a chlamydia urethritis is the case. And yeah, what was the investigation of choice for this? The options they have given is culture sensitivity and nucleic acid amplification test, LISA, it's a microscopy showing inclusion bodies. So yeah, if you can tell which is the investigation of choice for chlamydia urethritis. Anyone? Okay, the answer here is NAT. That is the nucleic acid amplification test is the investigation of choice for chlamydia urethritis. So in men, if it's in case of men, you have to take the sample from the first void urine. If it's a woman, you have to take from the vagina or endocervical swab you have to take. So yeah. So NAT is the LISA. No, LISA we don't do. NAT we do. LISA can be done, but yeah, NAT is the drug of choice. Not the drug of choice. Sorry, it's the investigation of choice. You can tell. So next we have a child presented with bilateral proptosis. From the peripheral smear, he was suspected to have a chloroma. What is the next investigation of choice? Options are platelet count, WBC count, flow cytometry, and bone marrow biopsy. So I repeat, it's a child who is presented with bilateral proptosis is there. From the peripheral smear, he was suspected to have a chloroma. So what is the next investigation of choice? Platelet count, WBC, flow cytometry, and bone marrow biopsy. So yeah, anyone? Scleroma, you know what is scleroma? Then only you can tell. Basically, scleroma, I will read the definition from here only. Scleroma is also called as myeloid sarcoma, or it's a granulocytic sarcoma or a myeloblastoma, whatever you can say. Basically, it's a tumor, it is extramedullary tumor, and it occurs in patient with AML. So yeah, it's basically a tumor which occurs in it's an extramedullary tumor which occurs in condition of AML. So now you can tell if you have a AML. So what is the investigation of choice after knowing that it's AML? Platelet, WBC, flow cytometry, or bone marrow biopsy. Anyone? Proptosis is the most common presentation. Yeah, we know that is okay. So yeah, okay, I will only tell it's see if it's just any leukemia or whatever. Yeah, bone marrow test is the right answer. If it's any leukemia, you do go for a bone marrow test to suspect. Yeah, bone marrow biopsy you do. Because WBC count, it's of no use. Platelet also is of no use. Flow cytometry also you cannot detect. Yeah, for it's an bone marrow biopsy the right answer. Next we have a 39-year-old contact lens user with a corneal ulcer, showing no improvement to tobramycin drops, and was referred to a tertiary care center. Corneal biopsy revealed a double-walled cyst within the stroma. What is the following the treatment of choice they are asking basically? And the options are polyhexamine biguanide, neomycin, propamidine, isothianate, or it's a nystatin. So I will repeat, it's a 39-year-old who is wearing a contact lens. 39-year-old with contact lens, and he has a corneal ulcer, and he is showing no improvement with tobramycin drops which they have been given, and then corneal biopsy was done which reveals a double-walled cyst within the stroma. So what is the treatment of choice? You have to tell basically what is the diagnosis, the only treatment of choice you can tell. So yeah, the options are polyhexamethyl biguanide, neomycin, propamide, isothianate, or it's a nystatin. If you can tell what is the diagnosis first. It's a case of corneal biopsy. Anyone? Okay, I will tell this. Okay, we tell the diagnosis, then only and you can tell. Basically, the diagnosis is acanthamoeba keratitis. Now, if you can tell what is the drug of choice for acanthamoeba keratitis, it's polyhexamethyl biguanide, neomycin, propamide, isothianate, or it's a nystatin. Anyone? Okay, the answer here is A. Answer here is A. That is the polyhexamethyl biguanide is the drug of choice for acanthamoeba keratitis. And combination with, yeah, we all know this, combination therapy with chlorhexidine is more effective in this condition. It will kill both trophozoites and cysts. So it's recommended for the first line therapy. So yeah, polyhexamethyl biguanide is the drug of choice for acanthamoeba keratitis. Now, yeah, the last question. It's a patient with long-standing pulmonary TB underwent CT scanning as given below. What is the diagnosis? Okay, without CT scan, you won't be able to tell. Okay, I'll just tell the CT findings here. Basically, yeah, it's a sign. It's a sign, that is, it's a gas around the mass within a pulmonary cavity. Okay, leave that. I will just tell the sign, you can tell the diagnosis. The sign is monod sign. MONOD, monod sign. So you just tell monod sign in CT scan is seen in which condition? It's a respiratory condition. And the patient with long-standing pulmonary TB underwent CT scan, and it shows monod sign. And the options are blastomycosis, pneumonia, aspergilloma, or bronchiectasis. So I will repeat, it's a blastomycosis, pneumonia, aspergilloma, or it's a bronchiectasis. So monod sign is seen in which condition? Anyone? Anyone can tell? Okay, I will tell. It's the last question, and yeah, the answer is C. In aspergilloma, it's a monod sign is seen, and monod sign is basically it's a gas surrounding a mass which is seen in the pulmonary cavity. So yeah, that's all. Without this, you have to see the CT scan, and then you will realize what is the sign. So yeah, it's done for today. Thank you so much.